When I reached the hospital, that was the time that I couldn't really breathe. They tried putting oxygen on me, and it was scary. It's as if somebody put a plastic bag over your head, and you couldn't get any oxygen. I'm originally from the Philippines. I'm a nurse. I worked for a long time in long-term care, nursing home. My wife and our daughter live in Durham now. My wife is also a nurse, and she works at Duke Regional.
I just want to say that he used to be a lawyer, and I'm so proud of him. When he was in the Philippines, he joined me to stay with the family. And our daughter is 15 years old now. She just turned 15, and she is a taekwondo black belter.
Well, at first, I wasn't really concerned. I heard about the outbreak in Washington State, but we were doing our best, taking precautions, and I didn't really think that it would hit the facility. One day I came home from work. I was feeling bad. I think it was March 23. So I stayed at home having fever for probably 7 days. And on the 7th day or 8th day, I went to Duke Urgent Care, where I was finally tested. And 2 days later, they told me that I was positive for COVID.
From the sound of the voice, I know that he is sad and he is scared too.
Was actually worried that I might, or I have already passed it on to my wife and daughter. I wasn't really thinking that I'd have to go to the hospital and be intubated and be in the ICU. I was thinking that I will just get better. And by the time that I got to the ER, my nail beds were already gray, and my oxygen levels were already in the 70s. With the people talking to me, it's just a blur. It's just like what you see in the movies. It's a blur. The only things you see are the faces, and everything else is dark and blurred.
Since visitors are not allowed there, I kind of think that, I'm shut off from Dante. So it's like you drop him off and you don't know what's going to happen to him.
First in the ICU or CCU, you're the only patient there. I don't remember much about the room because I was so weak I couldn't even turn my head.
This is something that the doctors doesn't know what it is. It's early in the COVID, They don't know the treatment yet, and it's the unknown. So what I did was to call my family, to call my coworkers, to call my friends, to ask for prayers.
I was attached to a ventilator for 10 days, and I could not even imagine remembering from now how I was able to do it. It was scary at first, but then when you're lying down there, not able to see your family, it worried me. I was worried about my daughter, my wife.
One of the nurses suggested what about if you record your voice, because he will hear you. And so I said, okay, that's a good idea. So I made sure that every day that I make a recording, and the nurses there, they will just play it on and on to remind Dante that we are okay.
The nurses played those messages to me, and that comforted me. And in the ICU, there's a big observation window, a glass window, and somebody wrote there, "You've got this." So every time I look there, it's it's an encouragement. One thing that I remember is when somebody wrote, "This will pass." So that gave me hope that yes, it will pass.
I'm grateful that they're doing that because it's different for family member to be out of sight while the COVID is going on. We don't have visitors then, so that's the only way that we can connect. And I'm so grateful for that.
They talked to me about Ludy, my wife, because my wife also works at Duke Regional, and they know her. They've known her for years.
So I trust these people that I work with. I know that they do the best they can, and I know even if it's not a family member, they really take care of this patient, and that's what we do. So I know that Dante will be taken care of.
And the day I was discharged, somebody was playing the theme from Rocky. I saw all the nurses and the staff lining the corridor and clapping their hands, and that was really good. I really felt that they cared for me, that I'm a human being. I felt valued.
At the regional hospital, you can trust them because they have the skill, they have the knowledge. They don't see the patient as a patient. Sometimes they see the patient as their own.
When you helped me, you did not just impact my life, you also helped my daughter, my wife, and my mom. So you had an impact on their lives too.
We chose Duke Regional because I know the people that I work with and I trust them. And I know that they will do whatever they can to help me and to help my family.
Now I am a dialysis nurse, and I will be working at Duke Regional. And I hope to work with the people who saved my life and maybe help them save other people's lives too.